Okay, this is how we hook up a portable E-size oxygen cylinder. The first thing we're going to do is attain our cylinder, make sure it's in a steady cart or it has one of those little round bases, or it could be secured to the wall in some instances. And the next thing we need to round up is our regulator, which is a combination pressure reducing valve and flow meter. This is a BOURDON type regulator, which is great for transporting a patient because it's gravity and position independent. It doesn't matter what position it's in, vertical, horizontal, or anything in between. And one of the first things we got to do after we acquire our equipment, the regulator, tank holder, and the wrench, is you got to crack the tank. Now, in cracking the tank, the reason we do that, so if there's any dust or foreign debris in there, it doesn't ruin this expensive regulator. But as a safety precaution, you got to make sure that you're not aiming at the patient or the nurse or anybody else around. And then what you're going to do is put the wrench on. You're going to say crack in the tank. That warns anybody in the room that there's going to be a loud noise. So we're going to do it. Cracking the tank. And that will blow out any of the foreign debris. Now, one thing with the PISS system, pin index safety system, this uses an oxygen tank. The pins are at 2 and 5, and this regulator here has a built-in washer. So we have our washer to ensure a good seal. It's that little white disc around the brass hub there that goes into the tank. So now we're going to take our regulator here, and we're going to loosen the T-handle, and we're going to carefully put it down, ensuring that the pins line up with the pinholes on the tank. Then we're going to take the thumb screw and screw it nice and tight with hand pressure. Don't use a wrench or anything. Now at this point we should be ready to go here. The regulator's on the tank, and we're ready to open the tank. We're going to slowly open the tank in case there's a leak. So there we go. The pressure gauge is showing that we got about 14 to 1,500 pounds. Now when you open the tank, the part that actually takes the longest is fully opening the tank. And the reason you do that is so people don't become confused in an intermediate position and turn it the wrong way and accidentally open it versus shutting it, and vice versa. So we're going to totally open the tank here, and when it's totally open, we're going to take it and back it off a quarter turn. The reason we do that is so the valve don't get jammed open due to thermal expansions and contractions of unlike metals that might exist in the assembly. Now, according to our doctor's orders, we need to set a flow rate for 4 liters per minute. So all we got to do is slowly turn this knob here, because the BOURDON tube is a fixed orifice variable pressure. So what we're actually doing when we turn this knob is we're changing the pressure against this little orifice in the regulator, which actually measures pressure, but it's going to read out in flow. And as I slowly turn this, you can see the flow going up to 4 liters per minute, and you could also hear it. Now, if the doctor's orders prescribed 8 liters per minute, then you would just continue to turn the knob here till it gets to 8 liters per minute, and as you can hear, it's flowing more. So, and that's that. If you were going to remove it, you'd remove everything from the patient first, and then you'd slowly turn the knob, reducing the flow back down to 0, and you would disconnect any of your hosing and other apparatus. Then what you do is you take your wrench here and you go ahead and shut the tank. Like just opening the tank, shutting the tank takes a little bit. So we're going to keep on shutting the tank. Okay, now once the tank's shut, don't just go right yanking off the regulator, or else you're going to make a loud noise, scare your patient, whatnot. But once again, you're going to slowly open the flow valve, And what this does is it releases that pressure, like 1,500 pounds that's in parts of this regulator. So we slowly open that flow valve, and as you can see, the needle goes up to a flow, and when the pressure is relieved, it's going to drop, and it just did. So now that the pressure is dropped, take the valve, put it back in the off position with no flow for the next person. And then you're going to hold the regulator, and you're going to slowly release the T-handle in case all the pressure wasn't relieved. Then you're just going to turn that back like so. And you're going to take the regulator and lift it up off the tank. And now you're ready to go on with whatever you're ready to do next. Thank you all and have a great day.